Counselor Ludwig. Counselor Sutherland.
Here.
Counselor Kern. Here. Counselor Dahlbeck.
Here.
Everyone is present.
We have a quorum.
Item number 3 is approval of the minutes from the October 6th regular council meeting. There were a few errors on those, and we have a revised copy in front of you. Those will be the ones that get published.
The motion is by Counselor Bender, the second by Counselor Fennessy to approve the minutes as updated and provided. Is there discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. The motion carries. Counselor Sutherland, you had a motion?
Yes, Mayor Payne, I'd like to make a motion to suspend the rules and move item 10.3 up to the top, please.
Sorry, who made the second? Okay, the motion is by Counselor Sutherland, the second by Counselor Fennessy to suspend the rules and consider item 10.3 immediately. That is under new business, City Attorney Prell seeking council approval to pursue injunctive relief against Karen Struhler. Discussion on the motion to suspend the rules? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. The motion carries. I would just reread that.
Oh, do you want me to reread it?
Yeah.
Okay. So item 10.3, City Attorney Pearl is seeking council approval to pursue injunctive relief against Karen Struhler, 2344 Lackawanna Avenue, to aggressively enforce the removal of junked vehicles and debris from the exterior of the property.
Motion to approve.
Before we consider motions, I believe there might be people from the public here to speak. Did anybody actually sign up? Is there anybody that would like, from the public, that would like to address the council? Go ahead and approach the podium, sir. What I'll ask all speakers is to state your name and address. You will be limited to exactly 3 minutes, and personal attacks against members of the council or the public are prohibited. If you could hit the button, it looks like a person speaking, third from the left.
To the right.
There you go. You got it.
Okay, my name is Scott Kraker. I live at 2334 Lackawanna. All I'm going to say is letters have been written to our city attorney. We've talked about this. I've talked to code compliance. I'm exhausted. I can't do any more. I'm here with my neighbors, and I would like you really to consider today what the city attorney is going to present. And that's all I have to say. I have no more words.
Thank you.
Okay?
Would anybody else like to address the council?
I would. I didn't sign up.
That's okay.
My name is Rhoda Nagurski. I, too, am a neighbor to the home in question here. I think that it's important for the council to understand that this has been a long-standing problem with this home. The home is in deplorable condition. It is a source of great stress and anxiety for all of the neighbors. The individuals who live in and frequent this home have a complete disregard for traffic rules. We are all concerned about the young children who come to our homes to visit and who live in our homes. It's an absolute safety hazard for those individuals that are traveling back and forth. It's a health and safety issue for all of the neighbors. We're all concerned about the debris in this yard attracting vermin. This has been a great source of stress and anxiety. I've long been concerned for those individuals who live very near this home. What you can't see from photos that have been taken is that there is frequently, in the night and early morning hours, a lot of noise and activity coming from this home. There are lights, floodlights and flashlights in neighbors' bedrooms. I implore you to grant the city attorney's request to take action on this matter as authorized by Wisconsin statute. This has just become such a source of stress and anxiety for all that live in the neighborhood. The neighborhood was recently described as a retirement neighborhood. And so we have individuals who simply wish to live in the peace and quiet of the neighborhood and enjoy their yards, and that has become untenable.
Just
And
30
the
more seconds, please, ma'am.
condition of the home is indefensible. Thank you.
Thank you.
Thank you.
Would anybody else like to address the council? What then is the pleasure of the council?
Motion to approve.
Motion is by Councilor Sutherland, the second by Councilor Bender. Is there discussion?
Yes, Mayor Payne, may I?
Councilor Sutherland.
Thank you. I'd like to just thank Lee Sandock Baker, our code compliance officer, and Frog Perel, Attorney Perel, and Heather in that office to really thank them for everything they've done. It's been strenuous. We should be focusing, our city should be focusing their energy elsewhere. And this is, I believe, the first time since I've been on the council that something like this has come up, where Lee has asked, our code compliance officer has asked our city attorney for some help here. And I think you guys have done amazing work. I appreciate it. And Councilor Kern and I have been working on this for a while. So just thanks to everyone for involved. And I'd like to thank everyone who came and spoke today. I know it's not the easiest thing, but thanks for reaching out.
Is there further discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. The motion carries. We are back in regular order.
Item 4.1, Douglas County Health Officer Kathy Ronkai is on virtually with us to provide an update regarding COVID.
Ms. Ronke, you have the floor.
Thank you. Everybody can hear me?
Yes.
Yes. Okay. I usually dial in with the video, but it wasn't working, so I called in. So I will have to assume everybody's got smiling, happy faces as I'm talking here. So I think I can just do I'm not exactly sure what you want to know, so I'll just give a quick update. Tuesdays, I do an update of our infographic that I put out a couple times a week. And so I'll just touch on that, and then if people have questions, I'm happy to answer them to the best of my ability. As of today, we have 701 people who've tested positive for COVID-19 since the onset of the pandemic, so since around March. And of the 701 positives, we've had 9,600 negatives, and that gives us a positivity rate of all people tested since the beginning of the pandemic of about 6%, almost 7%. And looking at positive cases by week, I was asked to start showing that. I know these numbers, as they get higher, it's hard to have context behind them, so I did start showing that. And we did have a surge in cases in the very end of September, the last couple weeks in September, and that has tapered off a little bit from over 75 or around 75 cases a week to 66 cases a couple weeks ago, and then 46 cases last week. So we are coming down a little bit, and I hope that we continue that trend. About 89% of all people who've tested positive have recovered, and that's kind of a fluid number. It's difficult to measure that as it's people who have come out of quarantine or isolation, and it's people who no longer have symptoms or people who've never had symptoms. Most people are experiencing symptoms for a few days, but we have had a number of people, especially in the older population, with a lot of underlying health problems who have been sick much longer than that. We've had about 24 people that have been hospitalized due to symptoms of COVID. And with that, we don't count the people who are going in for a total knee replacement and as part of their screening are found to have COVID. To me, that is not a COVID hospitalization. So our state numbers look a little bit different from what we count, just by about, I think it's about five cases different, because those are people that have were not hospitalized due to symptoms of COVID. We have one person currently hospitalized, and the hospitalization days is anywhere just from overnight for observation to a couple of weeks. So again, people with underlying health problems have had longer, more complicated hospitalizations. And we did have one death a couple weeks ago. That individual was in their 90s and in an assisted living facility, but they do believe that developing COVID disease accelerated her end of life. So we do count that one as a death. Let's see, with our long-term care facilities, as that is definitely our more vulnerable population, we have nurses assigned to the facilities, and we work with them routinely on prevention practices and safety sort of things. There's regular testing happening at all of the long-term care facilities. We have had a couple cases in a few different places, but because of the prevention strategies in place, it was very much limited to one or two people. It was not a widespread outbreak, but even one case at a facility is considered an outbreak. But again, the spread has been contained, I think, due to the strenuous practices that these places have in place to really protect people in their facilities. I am working with the Wisconsin National Guard to bring back some drive-through testing. We have a testing site this Friday, and it will be at 1101 Susquehanna. There's a drive-through garage area that can take 6 cars at a time, and I feel like that was perfect timing, being that we have the weather that we're having this week. So rather than have people try to manage all of this outdoors, we were able to move it into that location. Our other option was going to be one of the county garages out in Gordon, but we really felt that with the higher population and accessibility issues, that it was important to have that in Superior. So that's going to be on Friday, and we have 2 or 3 other testing days scheduled, and they will also be on Fridays, basically every other Friday except for Thanksgiving week. And when I get those dates finalized, I'll make sure that gets out. And this is with the National Guard, so this is nasal swabs, and this is free for anybody with symptoms or anybody who may have been a contact to someone. And there's a pre-registration that we encourage, and that makes us able to use the app that the National Guard uses, and that really cuts down on the amount of work for public health. It's an electronic method. If you have a smartphone or at least an email address, you can pre-register and go, and it makes the process much faster, and it makes the reporting of results much faster. If people don't have a smartphone or don't have the ability, the Guard will help them with that on site on that day. The most common age group that we are seeing with cases, not surprising, is the 20-somethings, but they are not all associated with our university. I want to be clear on that. We have had a handful of cases at the university. I'll have some information at the end of this week to be able to report out exactly the number, but they've had some really strict guidelines in place, and students know if they don't comply, they're asked to leave the campus. And those students want to stay, so I think the compliance has been fairly good. So there have been, like I say, a handful of cases, maybe around 10 altogether. So this 20-something population isn't necessarily directly related to the university, but it's definitely that age group. And And it's about 50-50 split, males and females, almost exactly 50-50 split as far as gender of confirmed cases. And the most common symptoms are cough, headache, muscle aches, all of those flu type of symptoms, which again makes it challenging this time of year with flu season being what it is. So we are really encouraging people to get the flu vaccine. I have ordered some flu vaccine, more than what we've had in the last few years, and we are going to set up a couple of flu clinics, particularly for rural senior apartment building, senior housing kind of places. We're just starting the planning for that, but we would really like to reach out to those people so they don't need to be going into a pharmacy or clinic or something like that and putting themselves at risk of getting COVID while they're trying to get their flu shot. So that's something that we're in the process of doing. And we may also partner with UWS to do some flu vaccine there as well for that population. And so again, we're kind of in the early stages of some of that planning, trying to target some of those areas. Let's see, I think that's all I had as far as a general summary. I was sent a few questions earlier. I don't know if you want me to go through those or if you just want to ask random questions. I'm not sure what you'd like to hear next.
I think I'll open it up to the council. Who would like
Okay.
to ask questions of Ms. Ronke? Councilor Sweeney.
I submitted some questions, so I would assume that she must have them.
Sure.
Yes, I do.
Well then, Kathy, if you want to just go through Councilor Sweeney's questions.
Okay. All right. Let's see. The first question was asking if Douglas County has a higher infection rate than surrounding counties. And what I would say to that is higher than some, not as high as others. Bayfield, Burnett, Washburn, those counties have a case rate similar to ours, but we are a little bit higher. But Sawyer and Ashland are definitely higher as a St. Louis County. We were at what the state considered a very high case activity level until I think last week or so. We went from very high down to high. And our trajectory was shrinking, meaning that our case numbers were slowing down a little bit. And so that is something that the state measures based on our communicable disease reporting system that my nurses enter case information into. We get all of the positive lab reports directly into our system, and then we do the contact tracing and things from there. So yes, higher than some, not as high as others. But in this whole region, this Northwest region, I think we're fairly similar in cases across that area. Sorry, I'm reading and talking here. If a Douglas County resident dies with the virus in a different county, which county counts it up? That's a good question. Deaths as well as positive cases are counted in the county that the person claims as a resident. So when you're signing up to get a lab test or you go to the doctor and you get your lab work done, whatever county or whatever your residence is listed as when you do that, that is who counts that case. So if a Douglas County resident dies at the hospital in Duluth, we count that. Same if we have somebody in the hospital here that maybe is visiting from out of town, we don't count that. That gets reported back to wherever their residence is listed. How is it determined if a citizen died from the virus or other causes? That's a good question, and it's definitely been a debate across the country, I think. In our case, when I had a conversation with the medical examiners and with the at the hospital, if a person has COVID when they do pass away, it is counted as a COVID death as far as I understand, and as far as our medical examiners go, they will count it as a COVID death. And what we're really trying to get to is that determination as a cause of death versus contributed to a death. And I think it's really important for the medical examiners and the physicians to really be talking about that and not just checking a box, but really being mindful in how that is considered. Again, if we have somebody who goes into the hospital for a knee replacement and they're found to have COVID, that isn't a COVID hospitalization. They were hospitalized, but not due to the symptoms. So it's really having good conversations and making sure that reporting data is accurate. So that's something that I have had many conversations with different situations that we have had to make sure that we're very clear. I want that reporting to be very accurate. Let's see, total number of residents hospitalized. Since March, we've had about 24 people hospitalized, and again, for various lengths of time. Sometimes it's just overnight to make sure that somebody's stable, and we have had a couple people that were in much longer, but did eventually recover, and those people all were older and had multiple underlying conditions. Currently hospitalized, we have one person currently in the hospital, and again, with multiple other issues, so having COVID on top of that has complicated their recovery. Cure rates in Douglas County, I'm assuming that means recovery, and we are, by our best estimate, is about 89%. Sometimes we don't hear back from people when we do that final call to make sure all symptoms are gone, because they say they're fine and they're back to work and back to life. So we assume that then they're considered recovered because they're able to do those things. It's been one of our challenges with contact tracing is, we have pretty good luck with having first conversations, but not so good having final conversations as people go back to their normal routines. Top 3 underlying conditions in Douglas County that contribute to COVID-19. I'm not exactly sure what you're asking there. Underlying conditions as far as like things that are contributing to our numbers?
Do you want to clarify that, Councilor Sweeney?
An underlying condition may be diabetes, obesity.
Oh, sure. Yep, so that is one of the questions that's asked during contact tracing, and hypertension, heart disease, and diabetes were the top 3. And asthma. Asthma is up there too. Probably, I think asthma more commonly than diabetes actually. But still not in large numbers. I would say of the 700 cases, maybe 25 reported having asthma. Now, again, we're taking a person's word for it. So, there could be more people that have underlying conditions and they just didn't share it. So that would be based on contact tracing interviews. So that's what those would be. What percentage of rate, men or women? I'm assuming you mean men versus women in positive cases. So that's about almost straight up 50-50, half men, half women. Any unique differences that contributes to deter the virus? Some people are pretty sure it's just strong constitutions in this northern area. But I do think over the last, even though our numbers have gone up, the severity of illness has tapered off a little bit. And we know that spending time in the outdoors has a lot to do with keeping immune systems strong and reducing the spread of the virus and that kind of thing. And, our numbers have gone up throughout the summer with a lot of people getting together. In our initial cases, when we first started really seeing our cases increase was shortly after Father's Day. Actually, we had a number of people who visited our area from other parts of the state, out of southern Minnesota, southern Wisconsin, and those were directly linked to some of those initial spreads. And with people in their visited many of the local bars. So initially we did put out a lot of information about crowded indoor places and the issues with the bars and things like that. But recently, we haven't been able to trace cases to any one particular place, but it's more just people getting together with people. Family parties, weekend parties, just people getting together with people. And it's not necessarily, we haven't had a consistent report of any 1, 2, or 3 places, but it's behavior. It's large groups of people getting together and spending time together. And it's people getting together with others while they're sick. I can't tell you how many cases we've had where people have, we ask, when did your symptoms start? Well, they started on Wednesday, but yet on Friday I went here, here, and here, and we had this family party, and we went to that wedding reception, and we went to this and that, and now we have 20 cases associated with that. And so more than locations, it's really been people who are not staying home and they're symptomatic, or they're going to work with a headache and a fever and a sore throat. All of these sort of classic symptoms that we all know can be COVID related. People just thinking, they're going to take some cold medicine and go anyway, and not really taking into consideration what that might mean for the people that they may be exposing. And that's been a real source of frustration and really a lot of pretty serious conversations with people. Sorry if I'm getting off track there. Some of this is a little bit frustrating to me because it's the same conversations we have over and over with people. So let's see, blood types having an effect on the disease. There has been some interesting information coming out, and this is studies where they've looked at blood types of people who have ended up in the hospital with COVID and that kind of thing. And right now they're showing an association with blood type O. There seem to be fewer cases, but then there aren't as many people that have that blood type either. So you have to take some of that into consideration with the studies. And there's less disease severity with O and B versus type A. So there's some interesting information coming out. It isn't an exact science, but it is interesting associations that they're having. Can you be reinfected? That is something that they're starting to really look at. We are having people who seem to be coming down with symptoms a second time. And again, this virus is fairly new, and we're not sure yet how long a person will be immune. We know right now sorry, my brain goes in many directions because there's so much to talk about with this. But with immunity and a person's developing antibodies, there's so much to learn yet, and there's so much information coming out that initially I think they really thought you couldn't be reinfected, and now they're thinking maybe some people can if they didn't have a very severe form of the illness initially. Could they get it again? But there's studies coming out showing that we need to be considering that, but there isn't anything confirmed yet, and how and who and when a person could get it again. But with coronaviruses, the nature of that type of virus, we know that people can get those more than once, and there's different strains, and a strain can mutate over time and become weaker. It might be more contagious, but not cause quite the same level of severity of illness and that kind of thing. So there's definitely still more research happening in that area. I think that was the end of his questions.
Are there other questions for Ms. Ronke?
I have a question.
Councillor Dahlbeck.
I would like to know, Kathy, how are the kids in school faring? Are there any cases coming out of the schools?
Actually, I've been a little bit pleasantly surprised, and I think that's a really good question. We have had a handful of cases since the start of school, a handful of cases around the county. There have been a few in Superior, a few in the Maple School District, a couple in Solon. There was one at Northwoods in Minong, but it was a Douglas County person. So we have had cases in the schools, But what I'm surprised at is how we are not seeing a lot of spread happening in the school. So when we have identified a positive student and that student then is home on isolation, then they quarantine those students that have been, the close contacts to them. And those kids at this point have not ended up testing positive, which is really good. And when we are seeing more than one kid, it's usually they are in activities outside of school together, or maybe they spent time with each other on the weekend or something like that. So we've had, I think I figured it out on last Friday, there was about an average of 7 students across the county per week. That's throughout the different schools. And that, I should say, not just students, that is students or staff, because we've had several teachers and a bus driver who've also tested positive. So that is altogether students and staff, about 7 per week around the county. And we've had pretty good compliance. I think quarantine, when the kids are exposed, and it puts all the kids that have been exposed on quarantine for 14 days, families get really upset. And we've really had to work hard with them and with the schools to really make sure only those kids that had a direct exposure are quarantined, because it really impacts the students and everything that goes along with being out of school. And honestly, I think that school is a stable place for kids to be. When we quarantine a class, these parents still need to go back to work for the most part. It's most of them. Not everybody has the ability to stay home with their child every day. So then we have kids that have to bounce around. So they're not just going home to quarantine, then they're going to grandma's house and auntie's house and the neighbor's house, or a parent volunteers to take them all to their house. So they're not quarantining like we think they're quarantining. They're being bounced around, and really I'm concerned of that increasing the risk of exposure when that kind of thing happens. And I understand families, this is what they have to do. People are really stressed and they need to work and all of these things. So we're really trying to make sure that quarantine, when that gets determined, and we work with the school nurses on making that determination, that is really what was necessary. I give the school nurses and the teachers a lot of credit, because we're really limiting spread in the school, and it's going, at this point, it's going really well.
Do you have more
Thanks,
questions,
Kathy.
Councillor Dahlbeck?
Mm-hmm.
No, thank you, I said.
Councillor Van Sickle.
Thank you. I just want to first offer condolences to the family that lost their family member, 9 or 90. It's difficult to have that timeline rushed. And just speaking of schools, I just want to acknowledge all of the parents that opted to have their kids learn virtually, because those buildings are not as full.
Correct. Right.
Right. Kathy, there is not one moment this year where I have envied you and your job. So I just want to acknowledge that I know that this year has been extraordinarily difficult for you. So I work with senior citizens, or at least I used to, up until March. And the isolation has been really difficult, and we've lost seniors over this year. And it's just, this is a population that's been particularly hard hit in a few ways. And one of them is that they have followed so many guidelines to the T that I haven't seen them since March, and mostly because they're not allowed in the building any longer. But you mentioned you would hope that the rate would be coming down a little bit, and there's some suggestion, at least, and you can clarify whether this is true or not, that the onset of winter will probably actually increase cases. Between the onset of winter and the yo-yo of legal challenges and things like that. So I guess I want to ask, what would you say to Douglas County residents who feel like public health or elected officials aren't doing enough to keep them safe?
Well, that's a good question, and I agree with all of those points that you were just making. I'm certainly not doing a job I anticipated that I would ever have. After 23 years of working for the county, I've never experienced anything like this. I can tell you that. And with the elderly, my heart just breaks for the lack of interaction families have had. My mom passed away in March, and she had been short time in a nursing home just before she passed away. And I can't help but to think, how would I have handled that? Probably not well, I can assure you. And, you know, with winter weather coming, would we anticipate seeing another surge? Very possibly, as people are indoors more. It is the nature of that. You know, we talk all the time, open your windows, but when it gets to be even below 30 degrees, people don't want to open windows, and I understand that. But it's encouraging those outdoor activities and things like that, but it's still realistically not everybody can or wants to do that. So I think that physical distancing is going to be even more important. And as far as people thinking we don't do enough, I know people think that. And it's like no matter what we do or how much effort we put into something or how much educational information we put out or what we do, there's criticisms from all sides, no question. And I don't know, short of, you know, locking people in their houses, what people think we can do, you know, anymore. But we have to consider that not everybody can stay home from work indefinitely. Not everybody can keep their kids home indefinitely. Not every child has a safe home to be in. Not everybody has that. And we have to think about that. As much as, you know, I might be able to work from home and do those things, I know not everybody can. And I have to take that into consideration. I know there's a lot of debate with the mask mandates, and it's an unfortunate thing that's become so political and a measure of personal rights and that kind of thing. That's very unfortunate because we know that a mask works as a barrier. We had a case with one of our large businesses where the person was positive, but she had worn a mask, and all of her coworkers were wearing masks, and they did not physically distance. And it was one of our first cases, and we potentially could have had about 15 positives out of that, but because they had been, you know, they had all worn their masks as they should have while working in close proximity of each other, not anybody else ended up coming up positive. So I just use that as an example where they work. It's a tool, but they don't work by themselves. It's physical distancing, it's staying home when you're sick, it's all of those other things as well. I know some people have been frustrated with, you know, the issue with enforcement. I can't go around to 500 and some businesses and try to enforce something that the governor has put in place. We do lots of education. We do lots of outreaching. Our law enforcement doesn't have the capacity to do that, and I know that's one of the complaints that I get is, you know, why are we not having law enforcement more involved? And if people were realistic in the size of our county and the abilities of them to do that, that's a big challenge as well. So none of these things are easy, and none of them are by itself. There's so many components that go into the decision making. I'm only one person, and I'm not sure how people think. You know, I've had people call me and be very upset that, you know, I'm responsible for the 43,000 people in Douglas County, and it's like, well, people have choice, and I'm hoping and encouraging people to do the right thing. You know, again, it's to stay home when you're sick and physically distance when you're around people that are not from your household. Those things are just as important as wearing the mask. Not everybody can wear a mask, and I get a lot of people who want to send me pictures of people not wearing masks, and they're very angry and they're confrontational. But I also am trying to be mindful of people who can't, whether they've got trauma in their history or a physical reason. They shouldn't have to worry about having to tell that to people. And I just feel like the people are exhausted. They're tired of this virus. They're tired of limitations, but we're losing our civility and that compassion for people. Instead of being angry and creating a scene or a fight, have some compassion, assume there's a reason, and then just keep your own distance. And it doesn't have to be a fight. It doesn't have to be us against them kind of thing. And if everybody just did their part, and I feel like this might be a little Pollyanna attitude, but it's true. If people did their part, we'd be able to maintain and come through this better without it being such a political firestorm every time somebody does something other people don't like. And it's exhausting for everybody, and I try to recognize that. But I also know, I can't make that be true for everybody. So I hope that somewhat answered your question.
Councilor Van Sickle, did you have more questions? Councilor Elm.
Hey there, Kathy. Thanks for all the work that you've done. This is Councilor Elm, and I don't know if you wanted to touch on the Halloween guidelines at all, just since that just has come out, and maybe you could inform everyone.
Sure. Again, trying to meet everybody's needs and desires. Wanting children to have something to look forward to and families having an activity to do. We support Halloween activities if they're done in a way that's mindful and thoughtful and with safety precautions in place. And this is something you can find on the CDC website and the state website. There's guidance that's similar. And basically, I think the conversations I've had with people trying to organize like the trunk or treat kind of situations for out in the county, as well as the trick-or-treating in the city, I think people can just be creative. You can either not participate and just be clear about that, leave your lights on, and that's okay, or participate in a way that where you'll limit that close contact. Don't have a big bowl of candy sitting out that all the kids are going to be touching and that kind of thing. But instead, individually wrapped bags. Or I saw a picture where somebody had little, like, chopsticks or something stuck in the ground with a treat taped to it. So it was all over the yard, and the kids just came and they picked one up, and the kids thought that was fun. Or hand candy out by sliding it down a PVC tubing down the stairs so kids don't have to come up to the stairs. So again, it's really trying to be creative and how can we do this in a way to reduce risk, but yet let the kids enjoy themselves. Yards being decorated so people walking with their families can take their time and enjoy it rather than rushing to many, many houses. Limit the number, just take your time and maybe talk to your neighborhood and try to put something into place where everybody's sort of on the same page with where that treats are going to be handled in a safe way. Kids have a mask as part of your costume, but I made a note in there, don't put a costume mask over the cloth mask, especially of a small child, because that could really cause trouble with breathing and things. But anyway, I think that there's a lot of ways to do things that would reduce risk and let kids enjoy themselves and be outside and take your time and that kind of thing. So I did put it on the Douglas County website, and we put it out on social media. And I have another one that I'll probably send out again next week as kind of a reminder. But, so that's for your families. But for adults, avoiding indoor crowded parties. Again, the indoor face-to-face, that type of environment is where transmission is going to be way more than trick-or-treating would be. It's going to be people who are meeting for drinks somewhere or a costume party or something like that where it's crowded and everybody's inside and the music's playing and everybody's shouting at each other. It's that is where the virus transmission is more likely to happen.
Thanks. I had another question, if it's okay. Looking to the future, when a vaccine is available, I mean, maybe you can't predict the future, but how do you see this being distributed, and how do you see that playing out, or do you have any information on that?
Well, they're definitely having conversations about how this is going to look. And I know that they're looking at distributing to high-risk people first. So in our area, what that most likely is going to mean is vaccine going to the hospitals and long-term care facilities first. and protecting those people first. One of the things that we are working on in public health with our flu vaccine is putting together a mass vaccine process. So when it does become readily available, and say we have a large number of doses and a lot of people to give it to, we're going to use these flu clinics as sort of a dry run or a preparedness exercise, sort of, for what that might look like for in the future if we have to mass vaccinate large numbers of people. We're going to put that into place. So that's one of the things that we're doing with our flu vaccine in preparation for anticipating that. But in the meantime, what I do know is it's going to be those populations first, vulnerable, elderly, people with underlying medical conditions, hospitals and that kind of thing.
Thank you. Well, just one last question. After all this time, I guess what would be your number one recommendation for the public to follow, having learned all this through all these months?
Sure. Honestly, it is the physical distancing and staying home when you're sick. As much as some people are, again, with the mask, very pro or against masks or whatever, that is one tool. But if you're wearing a mask and you have contact with somebody who's positive, you're still going to be quarantined and you're still going to be at risk of the disease, because masks, they're not 100% foolproof. They're not, people don't always wear them correctly. The materials are different. It's a barrier, so it's a tool, but by itself is not the it's not the number one answer. It's the physical distancing from people outside of your normal circle, and so physical distancing meaning that 6 feet, staying away from people, and for people to stay home if they're having any symptoms, or staying away from people, or making sure you really are masking up if you feel any sort of symptoms coming on, and being really mindful of who you're spending time with if you're having any symptoms at all. Again, I think the thing that has surprised me the most is how many people have been out and about and caused a huge number of exposures and other cases because they didn't manage their symptoms and stay home and stay away from people while they were sick.
Thank you.
Are there further questions? If not, then thank you very much, Ms. Ronke.
Thank you. Have a good night.
Ew.
Bye.
Item 5 is correspondence to be filed. Oh, no action. I need to put that on there. Item number 6.1 is the mayor's report.
I will be very brief. We've been working on a few things. Probably one of the most significant, especially today, is our snow removal priorities. Whenever there is a snow event in the city of Superior, we use two operative terms: snow clearing and snow removal. Snow clearing is the process of getting the snow out of the street, the actual plowing, but that creates the snowbanks on the side of the street that create a number of transportation hazards for all forms of transportation, but especially pedestrians and street parking, and inhibits future snow clearing operations. So the snow removal is the process of removing that excess snow from the side of the street. And that process has changed a lot in recent years, and we're trying some new things to make sure that we're benefiting those places that that need it the quickest and the most frequently to do that more effectively. I am not releasing the doc. We have a document that we are going to use. I'm not releasing it publicly in that we're not going to put it on the website or anything, because we expect that to change almost storm to storm. We're going to do a little bit of trial and error here. However, it's available for anybody that wants to see. You can call my office or Public Works. That is true of the public and the press as well. If folks want to just see what we're going to do in the first big storm, we'll show you. So it's not a secret. I just want people to be clear that that's going to change. So the other reason I'm bringing this up is if you got ideas throughout the winter, if you're seeing some problem areas, let us know, because we're going to be doing a lot of experimentation this year. Of course, the comprehensive plan is coming up at Plan Commission. Put a lot of work into selecting what I think is the right consultant. And we had some great conversations around election security. Today is the first day of in-person voting, which I was just talking with Clerk Kalan. Apparently it's going very well. A lot of people are voting. This will, however, be a very high turnout election, even on election day, even with a lot of people voting in advance. And there's been a lot of controversy and conflict and misinformation and outright lies about the safety and security and the integrity of our election. One, I just want to assure everybody that our election officials and the election inspectors, the people that actually work the polls, are all well-trained professionals, and this election will be carried out with integrity, and we will have an honest result at the end of it. However, that doesn't mean there's not going to be angry people at the polls, and we need to make sure that our poll workers are protected. So I think we had a great meeting with law enforcement and the clerk's office, and I think we're going to, I think that's going to work out very well. The only thing I want to bring up for upcoming is we're going to have a conversation about how we carry on with digital attendance at meetings going into the new year. Our state of emergency that's authorizing these different types of meetings expires at the end of the year, and our ordinance is pretty out of date anyways for 2021. So we should take a look at that. If anybody's interested in the subject, let me know. I'll happily invite you to those meetings. Otherwise, we'll discuss it in-house, maybe invite the council leadership and propose something in a few weeks, before the end of the year, certainly. That is all I have for a report, unless there are questions. Councilor Van Sickle.
Just for Clerk Kalan, how are you doing on poll workers?
We're doing pretty well. We could always use a few more just for a call-in sheet, because we anticipate losing a couple due to illness or whatever prior to the election or even on election day. So if people are interested, they can still get a hold of our office and we'll send them an application. But yeah, we should be doing pretty good.
Okay, then we'll move on to 6.2.
6.2, the mayor is recommending approval to reappoint John Vasky to the Liability Claims Committee and reappointing Gene Rosberg to the Parks and Recreation Commission.
Motion is by Councilor Bender, the second by Councilor Elma. Is there discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. Motion carries. Thank you, Councilor.
7.1 is the Finance Committee special meeting recommendations from September 30th.
First, Chairman Sweeney, do you have any report from the Finance Committee you'd like to give?
Thank you, Mayor. As you can probably see from this report, we've been busy the past month. We've had a number of special meetings, passing some budgets. One thing of interest, I would think we did pass with the work of the hospitalization committee. That's what I will call them. We passed hospitalization. They worked hard. I think we worked hard in the committee, and I think the results were health partners worked with us, including our, I'll put them under the category of an agent. So everyone worked diligently, and I'm happy to report it's passed. It's, I think we have a 3% increase for the year, which is good. It's not great, but it's good. Okay, we're working on. We aren't done working on that yet. We've got a ways to go. A number of the things, but that worked out. So. And we're moving ahead for next year. We're doing some planning now. I'm trying to get some things done so I can bring it to the committee. And so I'll be brief and just tell you things have worked well the last month. We've been a lot of meetings, and I think people on the Finance Committee will probably be happy when we will not have too many more meetings. So thank you.
What then is the pleasure of the council for 7.1, the meeting from September 30th? Motion is by Councilor Ludwig, second by Councilor Elm. Is there discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. Motion carries.
Finance Committee recommendations from October 8th.
Motion is by Councilor Elm, second by Councilor Ludwig. Is there discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. Motion carries.
And 7.3 is the Finance Committee recommendations from the special meeting on October 14th.
Motion is by Councilor Bender, the second by Councilor Ludwig. Councilor Kern.
I just want to add to my fellow colleagues that are on the finance and the department head, I apologize for missing that meeting. I got caught on the road and didn't have service where I was at, so I apologize for my absence, sir.
Is there further discussion? Councilor Fennessy.
Could you just let the record reflect that I'll be abstaining from this one?
The record will reflect Councilor Fennessy's abstention. Further discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. The motion carries.
7.4 is the Human Resources Committee recommendation from September 28th. Does the chair have a report?
At our September 28th meeting, we approved the request to fill 4 full-time police officer positions, 3 vacancies due to retirement, 1 due to resignation. We approved the request to fill a temporary clerk typist position in the city clerk's office to assist during the current election season, because we're expecting a high volume of mail-in voting and in-person early voting, which I think is actually taking place, correct?
Mm-hmm.
All right. We approved a revised updated job description for ESD facility planning coordinator. Based upon the recommendation by the city's health insurance committee, we approved a revision to the health savings account policy. For certain orthopedic surgeries, if covered employees use the providers, in other words, the doctors recommended in Health Partners Top Value Network, the city will put $500 into their HSA account in January of the year following their surgeries. And their top value, according to Health Partners, can statistically save the city money in the long run. And so it's hopefully it will be a win-win situation for both the employee and the employer. And they'll, I believe that the Health Insurance Committee is meeting tomorrow with more information to come to our employees. We approved revision to the library's emergency closing policy, which was approved previously by the library board. And the reason the library brought it forward is to the board to create their own policies is because, of course, the city holds separate weekend and evening hours that go beyond the city's hours, and so they felt that they needed their own emergency closing policy. And so in reviewing the library's emergency closing policies, it prompted us to think about reviewing and updating the city's emergency closing policies. So we'll be working on that in our coming agendas. Let's see, IT Director Dan Shea provided an update on the progress of our integrated payroll timekeeping software. And also City Attorney Perel and Planning Director Surik shared their insight and discussion regarding RW Management Group's recommendation about outsourcing legal matters. And that discussion is still ongoing. Can I answer any questions?
Unless there are questions for the chair.
All right. I move that we approve all the recommendations of the September 28th Human Resources Committee.
Motion is to approve. Is there a second?
Second.
The motion is by Councilor Ludwig. The second is by Councilor Bender. Is there discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. Motion carries.
Item 9.1 under old business is a resolution to call on Burlington Northern Santa Fe to resume payments for the claims submitted for abatement of dust residue. This was held from the the first meeting in October 6th.
So this question is pending then, and we can go right into discussion. Is there discussion on the resolution? See, Councilor Van
One quick thing. At the last meeting, I offered some background on how we got to this resolution, and then there's the information contained therein itself. And everybody here got the emails that were sent in. My particular favorite was from Kim Visker, who remembers her mother, Shar Backlund, and all of her neighbors picketing at the BNSF, and is still trying to look for a picture of that. Shar was an absolute titan of Eloise, and actually she testified in the lawsuit against BNSF that lasted approximately from 1968 to about 1974. I just want to read two other things quick, because this one you did not get, because I got it in the mail. This is from Mrs. Fellbaum at 4331 East 3rd Street. I have a couple of problems with the BN cutting off the payment. I had mailed my claim in and was told I would receive my check in June. This was before the cutoff date in July. I think I should still be able to get my check. The taconite dust is not getting any less. It comes inside my window sills and other places inside. It even gets on my table and chairs and anything I store in my screen house. I cannot get the red tint off my trim around my windows, even with washing it. Everything left outside is covered with it. I'm 82 years old with heart problems and cannot do this myself, which is a big expense for me to pay someone to take care of it. Barbara Fellbaum. And the other thing I wanted to just read really quick is is a notice that was just posted in the Telegram, actually, and it's from October 18th, 1970. So just a hair over 50 years ago, a meeting was set on, this was a meeting notice set on the taconite dust charges that were being brought forward. And the purpose of this meeting is to determine the progress of the Burlington Northern Railway Company in abating taconite dust pollution in the area of their Eloise taconite transfer facility. Residents of the area have charged that the beltline operation used to transfer taconite pellets to the ore docks emit dust, which they charge as damaging their health, homes, and property. And then just as a brief update, I am still in communication with the railroad. I am still optimistic that we will come to a solution that is fair to the residents that are most impacted by the dust on their homes and their property. And I just want to thank everybody up here for their questions and their support. And I hope that this resolution is helpful in the process. Thank you.
Is there further discussion? Seeing Councilor Kern.
Yeah, I just want to thank Councilor Van Sickle for all your effort on this. I was in that area conducting some business a couple weeks ago, and I was floored by the amount of residue that are on a lot of these houses. And you know, if any of these councilors have any question on this resolution, I'm not a big fan of usually getting involved in things like this, but just take a walk through those neighborhoods and see what those people deal with. Your opinion would change in a quick hurry. So thank you for everything that you've done on this.
Further discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. Motion carries.
Item 10.1, I'm submitting miscellaneous licenses for approval.
Motion approved.
Second.
The motion is by Councilor Bender, the second by Councilor Dahlbeck. Is there discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. Motion carries.
Item 10.2, and Information Technology Director Shea is submitting the professional service agreement with North Point GIS for a variety of GIS services through December 31st, 2021.
Motion is by Councilor Bender, the second by Councilor Ludwig. Is there discussion?
Yes, I have a question. Director Shea, just a quick question about this. Is North Point actually able to do or fill in the gap of what everything that Design Elemental was doing for the city? And if not, will we need other providers to fill that gap?
Yes, good evening. They won't be able to do everything that Design Elemental is doing. We had a very unique relationship with that company, but we're trying to do it in a kind of a piecemeal way. So between the city and the county, we have kind of a three-pronged approach that's going to take care of everything that Design Elemental was doing for us. And we hope to get through this year and the next year with this approach before taking a look at it to see what our long-term strategy is.
Okay, thanks. So that means we'll need some other companies to kind of fill in the other parts of the gaps then probably in the future?
Yeah, one of them's already been passed. It was
Yep.
some interns that we had that's going to take care of part of it. And the third part is actually Douglas County taking care of, which we have an agreement with them. So between those three is what's going to cover what we need to get through our interview processing and some programming issues.
Well, perfect. Good work on this, and thank you.
No, thank you.
Further discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. Motion carries.
Item 10.4, Public Works Director Janigo is recommending approval of the agreement with the Western Lake Superior Sanitary District for providing services related to disposal of household hazardous waste at an anticipated cost of $34,000.
Motion to approve.
Motion is by Councilor Dahlbeck, the second by Councilor Kern. Is there discussion? Seeing none, all those in favor, please signify by saying aye. Those opposed say no. Motion carries.
Item 10.5 is matters to be referred to the Liability Claims Committee, claim number 20-19.
The motion is by Councilor Ludwig, second by Councilor Bender to refer. Is there discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. Motion carries.
Item 10.6 is an ordinance introduced by the Common Council amending the traffic code, disabled parking zones by adding 1904 Baxter Avenue.
Motion is by Councilor Ludwig, second by Councilor Elm. Is there discussion? Seeing none, all those in favor, please signify by saying aye. Those opposed say no. Motion carries.
Collection Systems Engineering and Operations Manager Abramson and ESD Director Roberts recommending approval to award the emergency contract for cured-in-place pipe rehabilitation of sanitary sewer main to as an emergency service.
Motion is by Councilor Bender, the second by Councilor Ludwig. Is there discussion?
Yes, Mayor Payne.
Councilor Sutherland.
Can we just get if Director Janigo is on the line, or Ms. Abraham is in the audience there, can we get an understanding of what this is when you say it's an emergency?
Yeah, I'm here.
Okay,
I'm on the
Hi.
phone.
Okay, so it's an emergency. What do you mean by that? Can you kind of
Normal, if we were to do a normal bid procedure on this repair, it would take 3 or more months before it would be awarded to a contractor, and then it would be another 6 to 8 weeks before the work would actually be done. There's been some interesting things happening in Superior this year as far as the soils go because of the how dry it has been this year compared to how wet it's been previous year, and there's been a lot of failures, and this is the first one that we've encountered that's attributed directly to our sewer main. There's a hole in the top of the sewer main. I don't think it'll last, through the winter, and we want to get it fixed a lot sooner. And so if it's done as an emergency service per our ordinance, it'll take about 6 weeks to get it fixed.
Thank you very much.
You're welcome.
Further discussion? Councilor Fennessy?
I just had a question. With this, it just says in there that that ESD received a report of the sinkhole. When was that report received? Was that just like a day ago, 2 days ago?
It was about a week or two ago. It took a while for us to get a contractor lined up to televise the sewer main. We had to get someone to get a camera in there to see exactly what was going on, and then it was a couple of days to gather information on costs and stuff like that. So it's been a couple of weeks, but it hasn't been terribly long.
Okay, thanks.
Further questions or discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Those opposed say no. Motion carries. And unless there's business by counselors, we have no further business and are adjourned. Thank you, counselors.
Night, everybody.
Good night, Esther. Good night.